Imagine you're at dinner with some colleagues from work. During this dinner, your colleagues react differently than what you might expect. Did you say the wrong thing? Was that smile to be polite? Or because they actually like what you said? You can't read their body language. The lights are just too bright. The white noise of the restaurant is painful to filter through. Despite the sensory overload, you push on. Your companions seem not to notice. Now they're talking. They're asking if they want to grab dessert after this. Are you automatically invited? Or is this something just between them? Should you ask to clarify, or would that be rude? Were you really invited to dinner to begin with, or did you invite yourself? Should you leave? This is just a small example of what a social situation might seem like to an autistic woman. According to the CDC in 2020, 1 in 54 people will receive an autism diagnosis a year. However, boys will be 4 times more likely to receive that diagnosis. Why is that? Today, we'll be discussing and exploring the diagnostic process of autistic women and figuring out if this statistic is to say autism is truly male-dominated or simply catered more to male diagnostic criteria. For those of you wondering, what is autism? I follow Autism Speaks. I know all about autism. Do you? Autism spectrum disorder, the whole idea was introduced in the 1930s by 2 separate psychologists. One of the more famous was Hans Asperger, which the name Asperger syndrome derives from. Asperger syndrome, fun fact, has been recently removed from the autism spectrum disorder spectrum of disorders, as Hans Asperger was a Nazi and experimented on male autistic subjects during the Holocaust. Look it up, it's true, I promise you. Which has led to some inconsistent research and a lot of misdiagnosis because autism has been previously characterized with the spectrum. However, the spectrum that was previously used to characterize it was a linear spectrum, which is what a lot of people think the autism spectrum looks like. However, it's more like a color wheel. And what I mean by that is, see this linear spectrum in my entire tablet? This would be less autistic appearing, less symptom appearing, so not autistic. Whereas this side of the spectrum, people would see it as they show a lot of autistic traits, they are more autistic, as opposed to this color wheel theory. And the color wheel, you might have, let's see if I can pull up something for you guys. There we go. This right here, say this dot right here, was someone who had maybe really great sensory needs, however, struggled a lot socially. But then there's this side of the spectrum, where this person might have terrible sensory needs, excuse my handwriting, while has wonderful social interactions and loves being social. That is because in the last 10 to 15 years, the diagnostic criteria on autism has drastically changed with new research coming in. With that new research comes a lot of new information and a lot of misinformation at the same time. People are used to using the word retarded, which is no longer allowed, absolutely not. Or discussing someone having Asperger's or someone with autism because they've been taught first-person language isn't appropriate, which, by the way, first-person language is absolutely appropriate to autistic people if they are okay with it. So we have this name for this phenomenon, but how do we identify it in others? It's not as easy as a question as you think. 18 months to about 4 years old is usually when they start looking for the diagnostic criteria of children. And some of those behaviors may include things like a child lining up toys a certain way and you can't move them, or repeating things, or maybe not speaking early, like at 18 months they haven't said mama or dada. And some of these traits may appear and may not appear for everyone, because remember, autism is a color wheel and not a linear spectrum. Some traits may appear for some and may not appear for all, and vice versa. The challenges in female diagnostics is a little bit different than others. We have all this criteria, so why are women not getting diagnosed? Again, remember, while autism is a spectrum, it is not linear, and it's more of a color wheel. Those traits that may appear for some may not appear for all. And those challenges in female diagnostics and the median age for diagnosing a woman on the spectrum far differs from men, typically. A lot of research has shown that men typically is what we have based all of our diagnostic criteria on in the last 50, 60 years. And in the last several decades, that's slowly starting to change. However, it hasn't changed fast enough. Women are more likely to be misdiagnosed with ADHD or anxiety when they have an autism diagnosis because women typically present different symptoms. There's something called masking, which is a phenomenon where women will copy another person. So say in a social situation, there is the autistic female in a lunch table with 3 other neurotypical females. The autistic girl will copy the traits of the neurotypicals in order to pass, which is called masking. It's typically masking your autistic traits to seem more normal and fit in. Because of this hasn't really been very well examined, and so that's a big reason a lot of women get misdiagnosed, is because they're taught to hide their traits and they have an easier time copying social situations than men. With the evidence presented today, it begs the question, why are we not doing more research on autistic women? We can admit fault that when most of our research on ASD has been on male persons, but we can put more effort into researching the signs in women and educating specialists so more girls can get a proper diagnosis on the first try. It is mind-boggling that many women are misdiagnosed as adults, more so than men, and yet the female autistic representation is just so minuscule. It's unfair that society does not cater to an autistic person with low support needs, such as the example I gave earlier, especially women. Thank you.